paralysis. The word itself is enough to send shivers down one's spine. It conjures images of immobility, a life confined to a wheelchair and a future filled with uncertainty. But what does it really mean to live with paralysis? The word itself evokes a sense of helplessness, a profound loss of control over one's own body. It's not just a medical term, it's a life sentence that changes everything. Imagine the frustration of wanting to move your legs, your arms, or even your fingers, but finding them unresponsive. This loss of control is not just physical, it seeps into every aspect of life, affecting mental and emotional well-being. It's a condition that affects millions worldwide, robbing them of their mobility and independence. Rehabilitation centers and support groups become lifelines, offering a semblance of normalcy and community. Imagine waking up one day unable to move your legs, your arms, or even your fingers. The shock and disbelief are overwhelming. The simplest tasks become monumental challenges. This is the stark reality for countless individuals living with paralysis. The emotional toll is immense, often leading to feelings of resignation and isolation. Paralysis is more than just the inability to move. It's a complex medical condition with far-reaching consequences. It affects not only the body, but also the mind and spirit. It's a complex medical condition with far-reaching consequences, impacting not only physical health, but also mental well-being and social interactions. Physical therapy and emotional support become crucial components of managing the condition. The loss of mobility can lead to isolation, depression, and a diminished sense of self-worth. The social stigma attached to paralysis can be as debilitating as the condition itself, and a diminished sense of self-worth. The emotional scars run deep, often resurfacing in moments of solitude and reflection. The causes of paralysis are as varied as its manifestations. From traumatic accidents to neurological diseases, the pathways leading to paralysis are numerous and complex. From traumatic spinal cord injuries to debilitating diseases, the underlying mechanisms are diverse and often intertwined. Each case is unique, requiring personalized treatment plans. The underlying mechanisms are diverse and often intertwined. Understanding these mechanisms is crucial for developing effective treatments and improving the lives of those affected. Understanding these causes is crucial for developing effective treatments and improving the lives of those affected. Research and education play pivotal roles in this endeavor. This essay delves into the world of paralysis, exploring its types, causes, diagnosis, and management. It aims to provide a comprehensive overview that will be invaluable for both medical professionals and the general public. It aims to equip aspiring medical professionals with the knowledge and empathy needed to care for patients facing this life-altering condition. By understanding the complexities of paralysis, we can foster a more inclusive and supportive society for those affected. Navigating the world of paralysis begins with understanding its various forms. Paralysis can be a daunting condition, but breaking it down into its different types can help us grasp the unique challenges and management strategies required for each. By understanding these distinctions, we can better support those affected and tailor our approaches to their specific needs. Each type presents unique challenges and requires tailored approaches to management. For instance, the care strategies for someone with monoplegia will differ significantly from those for a person with quadriplegia. This is why a comprehensive understanding of the types of paralysis is crucial for medical professionals, caregivers, and even the patients themselves. To simplify this complex landscape, we can use the mnemonic "My Hungry Dog Plays Quietly," a handy tool to remember the different types of paralysis. This mnemonic stands for monoplegia, hemiplegia, diplegia, paraplegia, and quadriplegia. Each of these terms represents a specific pattern of paralysis affecting different parts of the body. Monoplegia, paralysis confined to a single limb. This type of paralysis can result from various causes, including nerve damage, localized injuries, or certain neurological conditions. Think of a pitcher who injures his throwing arm, losing function in that limb while the rest of his body remains unaffected. This scenario illustrates how monoplegia can impact daily activities and professional responsibilities, requiring specific rehabilitation and support strategies. Hemiplegia, paralysis affecting one side of the body, typically caused by strokes. Strokes can disrupt the brain's ability to send signals to the muscles on one side of the body, leading to weakness or complete loss of movement on that side. Imagine a stroke survivor experiencing weakness and loss of sensation on the entire right or left side. This condition not only affects mobility but can also impact daily activities, requiring extensive rehabilitation and support to regain as much function as possible. Diplegia paralysis impacting symmetrical body parts, often seen in cerebral palsy. This type of paralysis usually affects the legs more than the arms, leading to significant challenges in mobility and coordination. This might involve both legs being affected, leading to difficulty walking. Children with diplegia often require assistive devices such as leg braces or walkers to help them move around and participate in daily activities. Paraplegia paralysis of the lower half of the body, usually due to spinal cord injuries. This type of paralysis can result from traumatic events such as car accidents, falls, or sports injuries, which damage the spinal cord and disrupt the communication between the brain and the lower body. Picture an individual who uses a wheelchair for mobility after a car accident. Paraplegia requires significant adjustments in lifestyle and often involves extensive physical therapy to maximize independence and quality of life. Quadriplegia, the most severe form involving paralysis of all four limbs, often stemming from high cervical spinal cord injuries. This type of paralysis can result in complete loss of movement and sensation below the neck, requiring comprehensive care and support. This requires significant assistance with daily living activities. Individuals with quadriplegia often rely on caregivers and specialized equipment to help them with tasks such as eating, dressing, and personal hygiene, highlighting the importance of a strong support system and access to appropriate resources. The spinal cord, a vital communication pathway between the brain and the body, is an intricate and essential part of our nervous system. It acts as a superhighway for signals, allowing us to move, feel, and react to our environment. Without it, our brain's commands would never reach our muscles, and sensory information from our body would never make it to our brain. However, this crucial structure is highly susceptible to injury and disease. Even minor damage can lead to significant and sometimes irreversible consequences. Understanding the different types of spinal cord injuries is essential for diagnosis and treatment. Damage to specific areas can result in distinct patterns of neurological deficits known as spinal cord syndromes. These syndromes are categorized based on the location and extent of the injury, each presenting unique challenges and symptoms. To make it easier to remember these syndromes, let's use the mnemonic back to basics. This mnemonic helps medical professionals and students quickly recall the key features of each syndrome. Brown-Sequard syndrome. Imagine a sword slicing halfway through the spinal cord. This dramatic imagery helps us remember that this syndrome involves a hemisection or partial severing of the spinal cord. This syndrome, often caused by trauma such as a stab wound or gunshot, leads to ipsilateral, same-side motor loss, and contralateral, opposite-side pain and temperature loss. The unique pattern of deficits helps in pinpointing the exact location of the injury. Anterior cord syndrome. Picture a blockage in the front part of the spinal cord disrupting blood flow. This blockage can be due to various reasons, including trauma, ischemia, or a herniated disc. This syndrome results in motor and pain temperature loss below the injury level, while proprioception, sense of body position, remains intact. This means that while the patient may lose the ability to move or feel pain and temperature, they can still sense the position of their limbs. Central cord syndrome. Visualize the center of the spinal cord being compressed. This compression often results from hyperextension injuries, such as those sustained in car accidents or falls. This typically affects the upper limbs more severely than the lower limbs, often seen in hyperextension injuries. Patients may experience weakness or paralysis in their arms, while their legs remain relatively unaffected. Posterior cord syndrome. Imagine the back part of the spinal cord being damaged. This type of injury is less common, but can be caused by trauma, tumors, or diseases like multiple sclerosis. This syndrome leads to loss of proprioception, making it difficult to coordinate movements. Patients may struggle with tasks that require fine motor skills, such as buttoning a shirt or writing. Understanding these syndromes is crucial for effective treatment and rehabilitation, helping patients regain as much function as possible. Understanding the distinction between upper and lower motor neuron lesions is crucial for diagnosing and localizing neurological problems. Think of upper motor neurons as the commanders issuing orders from the brain, while lower motor neurons are the soldiers carrying out those orders in the muscles. Upper motor neuron (UMN) lesions. When the commanders are affected, the result is hyperreflexia, exaggerated reflexes, spasticity, stiffness, and a positive Babinski sign, an abnormal reflex. Lower motor neuron (LMN) lesions damage to the soldiers leads to hyperreflexia, diminished reflexes, flaccidity, weakness, and muscle atrophy, wasting.